Do you believe that a stroke almost never happens completely out of the blue? In reality, before a blood vessel in the brain becomes blocked or bursts, your body has already been quietly sending out warning signals, hidden codes, that only those who pay close attention can recognize. The problem is that most of us, especially people over 60, tend to overlook these signs, not because they don't care, but because the warnings are so subtle, so easy to mistake for everyday fatigue, stress, poor sleep, or simply, that's just old age, nothing unusual. Imagine one morning you notice your hand feels slightly numb for a few minutes, then it goes back to normal. The next day, you feel a bit unsteady while walking, and a few days later, a strange headache appears, different from any you've had before. All of these episodes pass quickly, leading you to think, it's probably nothing. But in truth, those seemingly harmless moments are silent warnings, the body's final whispers before it is forced to scream through a full-blown stroke. In this video, we will take a closer look at the early warning signals of stroke, the signs rarely mentioned in articles or even medical books. You will learn how to observe your body, recognize even the smallest changes, understand why these symptoms occur, and most importantly, know how to act immediately to protect yourself and the people you love. Because knowledge is not just power, it is the ability to save lives. Picture the brain as a high-performance engine, consuming about 20% of the body's energy every minute, yet unable to store oxygen. Every second without blood flow is like a grain of sand slipping into the gears. Damage happens silently, but the consequences can last a lifetime. Those early warning signals, such as tingling in the hand, weakness in the leg, dizziness, or changes in vision, are the first signs that the brain's gears are starting to malfunction. If ignored, the body has no choice but to sound a major alarm, and that is when a stroke can strike. The important thing is that you don't need to panic. By knowing how to recognize and respond in time, you can significantly reduce the risk. By the end of this video, you will not only know how to observe your body, but also how to take the right actions, from monitoring unusual symptoms and adjusting daily habits to seeking medical help immediately. You may be surprised to realize that your body has been trying to communicate with you all along. It's just that we often don't take the time to listen.
First, to prevent stroke, we need to clearly understand what this condition really is. Put simply, a stroke occurs when blood flow to the brain is interrupted, either because a blood vessel in the brain becomes blocked or because one bursts. When blood can no longer reach critical areas, brain cells begin to die within just a few minutes. If not detected and treated promptly, the consequences can be devastating: permanent disability, loss of mobility, impaired speech, memory loss, or even death. Worldwide, millions of people experience this brain attack every year, and the numbers continue to rise with age and lifestyle factors. You may wonder why the brain is so vulnerable. Although it makes up only about 2% of body weight, the brain consumes up to 20% of the body's energy and has an insatiable need for oxygen. Unlike the heart or muscles, the brain cannot store energy or oxygen for later use. Just a few minutes without blood or oxygen is enough for neurons to begin dying. Think of the brain as a factory running 24/7 with no breaks, constantly demanding fuel to operate. If the supply is disrupted even for a few seconds, the delicate gears can be damaged, causing long-term, sometimes permanent injury. There are two main types of stroke you need to understand clearly. Ischemic stroke. This is the most common type, accounting for more than 80% of all cases. It occurs when a blood vessel in the brain becomes blocked, usually by a blood clot or a cholesterol plaque. When the vessel is obstructed, the brain no longer receives the oxygen and nutrients it needs, and the neurons in that area begin to die rapidly. Hemorrhagic stroke. Although less common, this type is often more dangerous. It happens when a blood vessel in the brain ruptures, causing blood to leak into the surrounding tissue. This not only kills brain cells at the rupture site, but the pressure from the escaping blood can also damage nearby areas, leading to a high risk of death or severe disability. What's important to note is that whether caused by blockage or rupture, the early symptoms can look very similar and often very subtle. This makes it easy for older adults to dismiss them or confuse them with normal signs of aging: tingling in the hands or feet, mild dizziness, fatigue, or a fleeting headache. That's why recognizing these early warnings is more important than ever. These whispers are the golden window of opportunity to intervene and prevent devastating outcomes before a full-blown stroke occurs. The brain never gives us a break. It is an engine that runs continuously, consuming oxygen and energy at an incredibly high rate. Every minute we ignore its warning signs, neurons can suffer permanent damage. That is why understanding how stroke happens and the vital role blood and oxygen play for the brain is the foundation for recognizing the subtle signs, acting quickly, and protecting both yourself and your loved ones. Once we understand this mechanism, we realize that preventing stroke is not just about monitoring blood pressure or avoiding stress. It is also about noticing even the smallest changes in your body, listening to the whispers your brain sends every day. Because those very signals, if recognized and acted upon in time, can save your life before a stroke ever takes hold.
Everyone knows that age and genetics play an important role in stroke risk. But what is far more concerning are the everyday habits we think are harmless, yet quietly wear down the blood vessels and increase the risk of a brain attack. Picture your body as a complex system of water pipes. Blood is the flowing water, constantly delivering oxygen and nutrients to every cell. When the pipes become dirty, clogged, or start to leak, even a small change can cause serious damage, and the brain is the most sensitive of all. Many older adults often overlook major risk factors, such as high blood pressure, diabetes, high cholesterol, smoking, alcohol use, being overweight, lack of exercise, and chronic stress. For example, one person might frequently eat processed foods loaded with salt and fat while rarely walking or exercising. Another might spend the entire day sitting in front of the TV, drinking coffee and alcohol in the evening, and dismiss it as just normal for old age. These seemingly harmless routines are in fact the brain's silent enemies. Even a little complacency or delay in changing lifestyle habits can damage blood vessels and open the door for stroke to strike unexpectedly. Imagine living inside a matrix of risk. Processed foods, physical inactivity, ongoing stress, even air pollution, all working together, silently attacking your circulatory system without you realizing it. And this risk doesn't stop at stroke. It also impacts the heart, kidneys, memory, and the overall quality of daily life. The important thing is that you absolutely can make a change. Identifying and adjusting these risk factors not only lowers your chance of stroke, but also improves your overall health. More stable blood pressure, stronger blood vessels, sharper memory, and greater energy. Every positive step, even something as simple as a 20-minute walk each day, eating more vegetables, cutting back on alcohol, or quitting smoking, helps build a strong health fortress that protects your brain long before any warning signs appear. This is your opportunity to take charge of your well-being today before it becomes too late. Before a major stroke strikes, the body often tries to send out strong warnings, and one of the most important signals is a transient ischemic attack, or TIA, commonly known as a mini-stroke. But don't let the word mini fool you. There's nothing small about the warning it delivers. In fact, it is a golden signal, reminding you that the brain is in danger and at high risk of a real stroke if ignored. A TIA happens when blood flow to the brain is temporarily interrupted, depriving brain cells of oxygen for just a few minutes. The symptoms of a TIA are almost identical to those of a real stroke: facial drooping, weakness in the arm or leg, difficulty speaking, or trouble expressing thoughts.
The difference is that these symptoms last only a few minutes to less than an hour, then disappear completely. It is exactly this fleeting nature that causes many people to dismiss it, telling themselves it's probably nothing. But in reality, it's extremely dangerous. The risk of a full-blown stroke can be just days or weeks away if a TIA is not recognized and treated promptly.
To recognize and act quickly, the F.A.S.T rule is the key you must memorize. F. Face. Ask the person to smile. If one side of the face droops or the mouth looks uneven, this is a serious warning. A. Arm. Ask them to raise both arms. If one arm drifts downward or feels much weaker, it's a sign to pay attention to. S. Speech. Have them say a simple sentence. If their speech is slurred, words are mispronounced, or they can't understand the question, that's an important symptom. T. Time. If you notice any of these signs, call 911 immediately. Every second matters because brain damage happens extremely fast. The F.A.S.T, the rule doesn't just help you detect full-blown strokes, it also allows you to recognize a TIA, those first screams of warning before a real stroke strikes. In addition, if someone suddenly loses vision, experiences severe dizziness, or develops a headache unlike any they've ever had before, treat it as an emergency. Don't wait or hope it goes away, and get them to the emergency room immediately. Think of a TIA as your body's emergency alarm. If recognized and treated in time, it leaves no lasting damage. But if ignored, it's like disregarding a fire alarm in your home. The consequences can be devastating. Early recognition, fast action, and having a plan in place are the only ways to stop a real stroke from attacking your brain and to protect your life and long-term health. Simple knowledge like F.A.S.T, when applied correctly, can mean the difference between saving a life and living with severe disability. That's why you must never dismiss these fleeting signs the brain is trying to speak to you, and our job is to listen and act immediately.
But even before obvious symptoms like a TIA or the signs of F.A.S.T appear, your body often begins sending out more subtle signals, those whispers that most of us tend to ignore. In fact, these small signs are the key to recognizing stroke risk early, before it's too late. A fleeting moment of dizziness, tingling in the hands, or an unusual wave of fatigue that quickly passes, all of these may be warnings from the brain. Imagine the brain as an extremely sophisticated control center, equipped with thousands of sensors constantly monitoring every function. When something goes wrong, these sensors send out small alerts, just noticeable enough if you know how to listen. And it is often these quiet signals that come before a major stroke. If you pay attention in time, your chance of preventing serious consequences increases dramatically. Some of the most common whispers older adults may experience include unusual headaches, different from any headaches you've had before, possibly sudden or more severe. Not every headache is dangerous, but if it feels unfamiliar, take it seriously. Brief numbness or weakness. The face, arm, or leg suddenly feels strange, numb, or weak for just a few seconds, but it happens repeatedly. Even if it's fleeting, the brain is sending a warning signal. Dizziness or loss of balance. A sudden spinning sensation, difficulty standing steady, or becoming easily disoriented. If you were normally steady and suddenly lose your balance, don't brush it off. Difficulty speaking or stumbling over words, trouble expressing thoughts, forgetting words, or saying simple sentences incorrectly. This indicates the brain is being temporarily affected and could be signaling an impending stroke. Temporary vision changes, sudden blurriness, flashes of light, dark spots, or even brief double vision. These changes should never be ignored, especially if it's the first time they've occurred. Unusual fatigue, a sudden sense of exhaustion, completely out of step with your normal routine, even without exertion. This type of fatigue can sometimes be the brain's way of warning about a lack of oxygen or blood flow. So, how can you tell these signals apart from ordinary fatigue or aches and pains? Pay attention to 3 important points. The difference from normal. If the feeling is new and you've never experienced it before, don't dismiss it. Repetition. A symptom that seems to pass quickly but returns multiple times is an important warning. Accompanying risk factors: high blood pressure, diabetes, high cholesterol, smoking, or being overweight. If you have one or more of these, even the smallest signs must not be ignored.
Think of each signal as a warning light on your body's dashboard. When you notice it, listen and act promptly. Your chances of preventing stroke rise significantly. Share these symptoms with your doctor. Create an action plan and maintain a healthy lifestyle. This is how you protect your brain, extend your life, and improve your quality of living. These signs are not meant to frighten you. They are gifts from your body, helping you take action early and take control of prevention. Listening to your body today may save your future tomorrow. Like Margaret, an older woman who experienced fleeting dizziness and tingling in her hand, if those had been recognized and addressed in time, a serious stroke could have been avoided. Truly, every small sign carries value. It is a chance to protect yourself and your loved ones, to keep your brain healthy and active for years to come. Recognizing the body's whispers is the first important step, but taking timely action is truly the key to preventing stroke. When you know how to respond at the right moment, you not only lower your risk of stroke, but also build a sense of control, confidence, and peace of mind in daily life. Stroke prevention is not a burden. It is a choice for health, and that choice is entirely in your hands. Start by making it a habit to record any unusual symptoms, no matter how small. A fleeting moment of dizziness, slight tingling in the hand, an unusual headache, or sudden fatigue, all of these are signals from the brain. By writing down the time, frequency, and intensity of these symptoms, you create an early warning map for your body. This becomes a valuable tool for your doctor to accurately assess your stroke risk and recommend the right preventive measures. Think of each note as a brick in the fortress that defends your brain. But recognizing symptoms alone is not enough. You need a clear plan to act immediately. Always keep 911 within reach. Know in advance which nearby hospital has a specialized stroke unit, and prepare a list of medications you are currently taking. Imagine this as your escape plan. When a warning signal appears, you already know exactly what to do, where to go, and who will help. Preparing ahead not only saves precious time, but also reduces anxiety, helping you stay calmer when facing an emergency.
An important part of prevention is controlling the risk factors that can be changed, such as blood pressure. This is the #1 risk factor for stroke. Checking your blood pressure regularly and following your doctor's advice helps keep the pressure in your blood vessels stable. Blood sugar and cholesterol. Eating a healthy diet, cutting back on sugar and saturated fats, combined with regular checkups, reduces the risk of blood clots and plaque buildup in the arteries. Smoking and alcohol. These habits damage blood vessel walls and increase stroke risk. Cutting down or quitting altogether is a vital step to protect your brain. Weight and activity. Maintaining a healthy weight, walking 10 to 15 minutes a day, or doing light, age-appropriate exercises improves circulation and heart health. Prevention is not a burden. You can turn it into an enjoyable journey of better health. Adding more vegetables to your meals, reducing salt, staying hydrated, and getting enough sleep, small but consistent changes build up into a strong shield that protects the brain. Even short walks, reading, or a few minutes of meditation each day help reduce stress and improve blood flow to the brain. When you see prevention as an opportunity for self-care rather than a strict obligation, it becomes easier to stick with healthy habits. If you notice any sign, don't wait until symptoms become severe to see a doctor. Early conversations allow your doctor to assess risks, adjust medications, or suggest effective preventive measures. This is like checking your brain's early warning system. The more proactive you are, the greater your chances of stopping a stroke. Doctors can also guide you on how to monitor your health at home, from tracking blood pressure and heart rate to recording temporary symptoms.
Listen to your body and make observation a habit. Every sign, no matter how small, has value. Don't think, it's probably nothing. Each time you notice, record, and share a symptom with your doctor, you're taking a valuable step toward preventing stroke before it's too late. Think of it as a proactive game. The more alert you are, the better you know your body, and the greater your chance of protecting yourself and your loved ones. And prevention should never be seen as a solitary effort. Sharing information, reminding each other of warning signs, and maintaining healthy routines together create a supportive, positive environment. For older adults in the U.S., having a strong support network helps reduce loneliness, increases motivation to stay healthy, and improves overall quality of life. We've just explored everything from TIA warning signs and the brain's subtle whispers to an action plan you can start using today. Every healthy decision you make, whether it's eating a balanced meal, taking a 10-minute walk, or checking your blood pressure at home, is like laying another brick in the fortress that protects your brain. Small actions, built up over time, create a powerful difference. Stroke prevention is not about fear. It's about having the power to choose health and longevity. Listen to your body. Act quickly, maintain healthy habits, and lean on the support of family and community. In doing so, your brain is protected, and you can live with confidence, independence, and peace of mind for years to come. Each decision you make today is an opportunity to secure your tomorrow. And finally, be positive but patient. Stroke prevention is not a challenge to conquer in a day or a week. It is a lifelong journey, a way of respecting your body, protecting your brain, and preserving your independence in the years ahead. Every step you take, every healthy habit you practice today is a gift to yourself and to those you love. You can share your experiences, stories, or lessons from your own health journey in the comments. Doing so not only helps you, but it can inspire and empower thousands of other older adults who are watching this video. And don't forget to subscribe and turn on the notification bell so that each week you'll receive practical, science-based knowledge to protect both your brain and your heart. Take action today, because every minute, every decision is priceless for your health and for the ones you love.